everyone. I am Dr. Gayathri, Assistant Professor at Smriti College of Pharmaceutical Education, Indore, from the Department of Pharmacology. In our today's class, we will look at what are hematinics and how do they work. So by the term itself, we can understand that hematinics are the drugs which are related to blood. So hematinics are nothing but they are the substances that are required in the formation of blood and therefore they are used in the treatment of anemia. So anemia occurs when there is an imbalance between the production and the destruction of RBCs. So either the production is less or the destruction or loss of RBC is more. This happens in conditions such as when there is blood loss, either acute or chronic blood loss, or impaired RBC formation. This can be due to three reasons. One is deficiency of essential factors, that is factors that are important in the formation of RBCs. They are iron, vitamin B12 and folic acid. And then the second reason is bone marrow depression, that is hypoplastic anemia. And the third reason is erythropoietin deficiency. We know that erythropoietin is responsible for the formation of RBCs. And the other reason can be increased destruction of RBCs as in hemolytic anemia. So coming to the distribution of iron in the body, iron is an essential body constituent. We know that it is an essential constituent also in the blood. So total body iron in an adult is about 2.5 to 5 grams. That is, on an average it is about 3.5 grams. It is more in men, that is 50 mg per kg when compared to women. In women it is only 38 mg per kg. So it is distributed into different parts, that is as hemoglobin, 66% of iron goes into formation of hemoglobin, that is and then the iron stores, that is as ferritin and hemosiderin, that is 25%, and parenchymal iron which is present in enzymes and other things, that is 6%, myoglobin, that is in muscles, about 3%. So because iron is distributed in different parts of the body, different constituents of the body, when there is a deficiency of iron, it is not just seen in blood, that is as anemia, but severe iron deficiency, the symptoms of severe iron deficiency or the effects of severe iron deficiency are seen almost in every cell. So dietary requirements of iron are adult male 0.5 to 1 mg and adult female 1 to 2 mg and infants 60 micrograms per kg, children 25 micrograms per kg and pregnant women 3 to 5 mg especially in the last 2 trimesters. And coming to the dietary sources of iron, the sources which are rich in iron are liver, egg yolk, oysters, dry beans, dry fruits, wheat germ and yeast. And medium sources are meat, chicken, fish, spinach, banana and apple. And poor sources of iron are milk and its products and root vegetables. So there are different types of anemia. They are microcytic anemia. From the name itself we understand that microcytic, that is small size. So RBC size is small in this type of anemia. And then macrocytic, that is macro is nothing but large. So RBC size is larger than the normal in macrocytic anemia. Coming to the next one, microcytic hypochromic anemia. So in this RBC size is smaller than the normal and hemoglobin content is lesser than the normal. And then aplastic anemia. It is a condition in which inadequate RBC formation is seen, which is resulting because of bone marrow degradation. So RBC size in aplastic anemia is normal, but the RBC formation is inadequate. Coming to the next one, hemolytic anemia. So in this condition, there is an increased destruction of RBC. When we were seeing in the introduction, anemias happen when there is an imbalance between production and destruction. So in this, there is an aplastic anemia, there is inadequate formation. Whereas in hemolytic anemia, there is an increased destruction of RBCs. So in this RBC, in both these types, RBC size is normal and hemoglobin content is also, in this hemolytic anemia, hemoglobin content is normal. And the next one is iron deficiency anemia. From the name itself, we understand that this is because of inadequate iron content or loss of iron due to hemorrhage, that is bleeding. In this type also, RBC size is normal, but hemoglobin content is lesser than the normal. Then coming to megaloblastic anemia. In this condition, erythrocytes fail to mature because of vitamin B12 or folic acid deficiency. We have seen, we know that vitamin B12 and folic acid are essential in the formation of, in the maturation of RBC. So, in conditions where there is a deficiency of either vitamin B12 or folic acid, erythrocytes fail to mature, that is RBCs fail to mature. And then the next type is sickle cell anemia. In this, by the name itself, we understand that the RBC, which is biconcave in shape, in normal conditions, RBCs are biconcave in shape, but in sickle cell anemia, the shape of RBC turns into a sickle shape. Why this happens? This is a genetic disease of RBCs. So in this, normally RBCs are biconcave shape, which gives them the flexibility. So because of this shape, biconcave shape, RBC can freely or flexibly travel even through the smallest blood vessels because they are in biconcave shape. But when the shape changes to sickle shape, this is impaired. So in this disease, RBC have an abnormal crescent shape, that is sickle shape, resembling a sickle. So this makes them sticky and rigid, which prevents them from flowing freely and causing them to get trapped in the small blood vessels, which causes a blockage of blood from reaching different parts of the body, which can result in pain and tissue damage. So the last type is pernicious anemia. So in this type, this type of anemia is seen more in older people as a result of a factor called intrinsic factor, which is essential for absorption of vitamin B12. So if vitamin B12 absorption is impaired, then maturation of RBCs is impaired and all other functions are impaired. So the maturation of RBC in bone marrow becomes disordered, and the lateral and posterior columns of spinal cord deteriorate RBCs and WBC count is also reduced. So in this condition, RBC maturation is not happening, as well as deterioration of RBC and WBC is happening. So this can result in symptoms like weakness, tingling, numbness in legs and arms, fever, pallor, anorexia, weight loss, etc. So this condition can be treated by giving vitamin B12 supplementations so that the imbalance of vitamin B12 can be normalized.